Hi all. Social work practice with differently abled children at special schools is a unit from the course School Mental Health and Social Work Practice of Mahatma Gandhi University syllabus for Masters of Social Work students. We are going to deal with the topic social work practice with differently abled children and special schools. The concept, the role of special schools, the social work practice with differently abled children, the role of social worker, and the challenges on the social work practice on direct application. So, this is presented by Elizabeth Jones, trainee social worker, fourth semester. Going to the introduction, differently abled children faces various physical, intellectual, emotional, and social challenges that may affect their learning mental health. Educational settings plays an important role in supporting their overall development. School mental health and social work practices focus on creating an inclusive, supportive, and enabling environment for such children. Special schools provide structured educational and therapeutic services tailored to the needs of differently abled children. Social workers plays a vital role in promoting mental well-being, social adjustment, and educational inclusion. So, going to the concept of the differently abled children, children with physical, sensory, intellectual, or development disabilities is considered as differently abled children. Differently abled children refers to children who experiences physical, sensory, intellectual, developmental or emotional disabilities that may affect their learning and daily functioning. The Rights of Person with Disability Act 2016 recognizes various categories of disabilities including intellectual disability, autism spectrum disorder, specific learning disability, visual impairment, hearing impairment, locomotor disability, multiple disabilities. These children requires individualized education plans supporting learning environments and psychosocial interventions to achieve their full potential. So we need to focus on their abilities, not their limitations. A right based and an inclusive approach is needed for their well being and development. Next, role of special schools in mental health and education. The special schools are educational institutions designed to meet the specific learning and developmental needs of differently abled children. They provide a structured environments with the trained professionals and adaptive teaching methods and support services. As special schools have certain functions, they provide specialized teaching methods, offer therapeutic and psychosocial services, create safe and structured learning environments, promote emotional well-being and independence. Individualized and specialized teaching methods will be there. Then therapeutic services like speech, occupational and behavioral therapy will be provided. Emotional and psychosocial support will be given, which is individualized. Then skill development and vocational training will be given. Then these special schools promote the self-confidence and independence of the children. The special schools also plays an important role in addressing mental health concerns by offering a safe and nurturing environment that reduces the anxiety, stress, and social isolation among children with the disabilities. Next, social work practice with differently abled children. So, the social work practice in this sector is through the early identification and assessment, individualized casework and counseling, group work and social skill training, family support, and parent guidance. So, the early identification and assessment is the social workers will assist in early identification assessment of disabilities and related emotional and behavioral issues. These help in planning appropriate educational and psychosocial interventions in collaboration with the professionals. Then individual casework and counseling includes Through this casework, social workers addresses the emotional problems, behavioral issues, and adjustmental difficulties in children. Counseling helps children improve their self-esteem, coping skills, and emotional stability. Then group work and social skills training means the group activities help children develop communication, cooperation, and social interaction skills. The group work also reduces isolation and promotes peer support. Then family support and parent guidance. Family often experiences stress and stigma. Social workers provide parent counseling, psychoeducation, and connect families to welfare schemes and support services. Then, other services given by the social workers is advocacy and inclusive education. Means social workers will advocate for the right of differently abled children by promoting inclusive education, preventing discrimination, and ensuring access to educational and mental health services. Then, multidisciplinary collaboration means effective practice involves working with teachers, psychologists, therapists, and school administrators to address the child's educational and mental health needs holistically. Next is what are the role of the social workers in this setting? So, here it is given the assessment of child and family needs, counseling and emotional support, advocacy for rights and inclusion, coordination with teachers and professionals. There are several roles a social worker have. Social workers, in collaboration with the teachers, parents, identify, evaluate early students with behavior problems, learning difficulties, and other developmental problems. In group work, they compile and implement preventive or rehabilitation plans to help in establishing learning environments for all children, especially for those with special educational needs. Then, conducts preventive actions against violence, abuse, and neglect, particularly for children with disabilities. Organizes training programs for school staff to enhance inclusive and disability friendly classroom practices. Then, counsels parents on the importance of continuing education based on children's abilities and potential. Then, initiates and conducts research on the needs of children with disabilities and promote sharing of best practices among schools. Then, the social workers provide individual support to parents or caregivers, ensuring a safe space for open discussion. They facilitate parent support groups to encourage experiences, sharing, and mutual support. They work directly with older children and adolescents, individually or in groups, focusing in psychosocial development. These are certain roles a social worker had in this setting. Despite this, there are different challenges in application of the social work practice with differently abled children. Some of it is given here. The main challenge facing is about the social stigma and discrimination everyone having with these mental problems. Then a lack of trained professionals is also a challenge. Then limited resources in the special schools also is a challenge. Then parental stress and lack of awareness can also cause bad to the children. Then the policy and implementation gaps is there. It also makes a challenge in social work practice. So moving to the conclusion, social work practice with differently abled children in special school is essential for promoting inclusive education, mental health, and overall development. Social workers plays a multidimensional role as counselors, advocates, facilitators, and coordinates in addressing the complex need of these children. Through assessment, individualized intervention, family support, advocacy, and collaboration with multidisciplinary teams, social workers contribute significantly to enhancing the quality of life of differently abled children. Strengthening school mental health services and inclusive practices ensures that every child, regardless of ability, is provided with opportunities to learn, grow, and participate meaningfully in the society. That's all about the topic. Thank you.